If you look at variation in care across the US, it is enormous. How often we do procedures, how often we do tests, what kinds of treatments work, what don't work. The reason that variation exists is because we don't have great answers. So what Truveta can help us do is by having better data, longitudinal data that links together both underlying health of individuals together with treatments, together with outcomes, we can actually learn what treatments, what opportunities work best, and then reduce variation by choosing those that work best and getting them broadly into practice. So tools that help us understand variation, tools that help us design what works, and then tools to reduce variation so we get better care at more affordable costs for all of our communities. 2020 was an incredible year in healthcare, obviously across the entire globe being challenged with COVID, with a new pandemic. It took us several months to figure out what worked. We heard early on from China that we should put people on breathing machines, on ventilators very rapidly. We found out several months in that actually was a bad plan, that it caused more harm than good. And so aggregating information, getting sufficient data on interventions and outcomes quickly potentially could have saved lives early in the pandemic. The more data we have, the quicker it is to get to easy answers about what works and what doesn't. So fortunately, we made great progress with COVID in a year. I'd like to make great progress on the next pandemic in a month.